On January 7, 2022, new offenses were added to the criminal code, making it illegal to provide, promote, advertise, or profit from conversion therapy. In this video, we will discuss what conversion therapy is and what you need to know about the law in Canada. Please be aware that this video will contain some discussion of harmful practices that may be upsetting.
Conversion therapy is sometimes also called reparative therapy. It is the practice of trying to change a person's sexual orientation, gender identity, or gender expression. It means trying to turn a gay or bisexual person straight, or trying to force a person to identify as the gender they were assigned at birth. The idea behind conversion therapy is that diverse sexualities and gender expressions are an illness, and that people can and should be cured of them. Conversion therapy has been discredited by medical professionals around the world, as well as the United Nations, World Health Organization, and Amnesty International. In some countries, conversion therapy is illegal for minors or illegal for medical professionals to practice. In a few countries, including Canada, it is completely illegal. We'll talk about what this means in a moment. Conversion therapy does not include practices and treatments that help people with gender transitions or exploring their gender identity or sexuality in an open and positive way.
Conversion therapy is not a scientific practice and can take many different forms. In the past, doctors and psychologists tried to suppress homosexuality with many different methods. These included lobotomies, a type of surgery that cuts the connection between parts of the brain, chemical castration, which means reducing hormone levels with drugs, and aversion therapy techniques like giving electrical shocks or drugs that caused nausea whenever the patient showed a so-called homosexual tendency. These methods were controversial even when they were being used, and they are not very common today. Modern conversion therapy usually looks more like a normal therapy session, with a practitioner having a one-on-one session with a client or a group session with several clients. Like other forms of therapy, it may involve talking about feelings and working on changing thought patterns. However, these sessions focus on the idea that being attracted to the same gender or not identifying with your birth gender is unnatural, wrong, or undesirable. The conversion therapy provider may encourage the client to suppress their feelings or urges. They may bully the client into feeling worthless or broken. Many conversion therapy programs are religion-based and may be run by or connected to a church or other religious organization. Religious conversion therapy may include practices like exorcism, ritual cleansing, self-harm as a form of penance, or calling on a higher power to change thoughts or desires, which is sometimes called praying the gay away. In more severe cases, people undergoing conversion therapy may be starved, isolated from other people, or even assaulted.
A recent Canadian study found that nearly 10% of non-heterosexual people who identified as male, non-binary, or two-spirit had experienced conversion therapy at some point in their lives. Over 20% of the study's participants experienced other attempts to change sexuality or gender identity in a less formal setting, for example, by a parent or a community leader. The study found that conversion therapy experiences were more common among people with lower incomes, among non-binary and transgender people, and among racial minorities. It is also more common among younger people. Of those who had experienced conversion therapy, 72% had first experienced it before age 20.
There is no reliable evidence to suggest that conversion therapy is effective. Several studies from around the world suggest that trying to change a person's sexual orientation or gender identity simply does not work. Most studies also show that conversion therapy causes psychological damage. This includes a higher risk of suicidal thoughts and suicide attempts, higher rates of depression and anxiety, higher rates of drug or alcohol abuse, sexual problems, and low self-esteem.
Section 320.101 of the Criminal Code defines conversion therapy as any practice, treatment, or service designed to make a person conform to heteronormative or cisnormative standards, based on the false assumption that a particular sexual orientation, gender identity, or gender expression is preferable to another. Sections 320.101 to 320.104 of the Criminal Code make it illegal to provide, promote, advertise, or profit from conversion therapy in Canada. Providing conversion therapy means giving conversion therapy services to another person. This includes causing someone to undergo conversion therapy, even if you are not the one actually providing the services. Promoting conversion therapy means actively encouraging conversion therapy. Advertising conversion therapy means advertising a particular conversion therapy service. Profiting from conversion therapy means receiving some kind of benefit from it. This could be money or something else, like a job promotion. Promoting or profiting from conversion therapy carries a maximum penalty of 2 years in prison. Providing conversion therapy carries a maximum penalty of 5 years in prison. It is also illegal to take a person under 18 years of age out of Canada for conversion therapy. This offense carries a maximum penalty of 5 years. See Section 273.3 sub 1 sub c. The Criminal Code authorizes courts to issue warrants that allow police officers to seize any materials that advertise or promote conversion therapy. This includes written materials, audio or video recordings, and photographs. Courts are also authorized to seize a copy of these materials if they are stored on a computer system and to make the materials unavailable to anyone else. See Sections 164 and 164.1.
If you or someone you know is being pressured into conversion therapy, you can file a report with the police. Clinic offers a free 24/7 confidential crisis line, 204-786-8686 in Winnipeg, or toll-free outside Winnipeg at 1-888-322-3019. You can call this number for support or to find a referral to another service that can better suit your needs. Trans Lifeline has a support hotline for and staffed by transgender people. 1-877-330-6366. Rainbow Resource Center offers support groups and counseling for LGBTQ+ people. Visit rainbowresourcecenter.org for more information. For legal information or for help finding a lawyer, call CLIA's Law Phone-In and Lawyer Referral Program at 204-943-2305 in Winnipeg, or toll-free outside Winnipeg at 1-800-262-8800.